Can stem cell transplant cure T-cell lymphoma? Can stem cell transplant cure T-cell lymphoma? This is a question many patients and families face when dealing with this complex disease. T-cell lymphomas are a diverse group of non-Hodgkin lymphomas that arise from T lymphocytes, a type of white blood cell. These lymphomas can be aggressive and vary widely in their behavior and response to treatment. When it comes to treatment, chemotherapy is often the first step. For patients who achieve remission, particularly those with higher risk disease, stem cell transplant can be an important next step. There are two main types of stem cell transplants: autologous, which uses the patient's own stem cells, and allogeneic, which uses stem cells from a donor. Autologous stem cell transplant is typically performed for patients who respond well to chemotherapy and are in their first remission. Studies have shown that patients who undergo this procedure can have significantly better outcomes. For instance, those with chemotherapy-sensitive disease might see 4-year survival rates around 80% when they have the transplant in first complete remission. On the other hand, allogeneic stem cell transplant may be considered for patients whose disease has relapsed or is resistant to treatment. This type of transplant can offer a graft versus lymphoma effect, where the donor's immune cells help fight the cancer. Some studies indicate that around 60% of patients may survive for 3 years after an allogeneic transplant, but this option comes with higher risks, including infections and transplant-related complications. However, it is important to note that stem cell transplant is not a guaranteed cure for all patients with T-cell lymphoma. The disease's aggressive nature and diversity mean that relapses can still occur after the transplant. Ongoing research is exploring new strategies to improve outcomes, such as combining stem cell transplants with innovative therapies like CAR T-cell therapy, which modifies a patient's T-cells to better target lymphoma cells. In summary, while stem cell transplant can be a potentially curative option for some patients with T-cell lymphoma, especially when done in first remission for those who respond well to chemotherapy, it is not a definitive cure for everyone. Each patient's situation is unique, and treatment decisions should be made in consultation with healthcare professionals who specialize in lymphoma care. Always seek personalized medical advice to understand the best options for your individual circumstances.